This is the Dr. A Explains It All podcast, a podcast about cosmetic procedures, skincare, dermatology, and everything in between. I'm board-certified dermatologist Dr. Arash Akavan. Let's get started. But first, a quick disclaimer.
Medical disclaimer. The information provided on this podcast is for general information and educational purposes only. It is not intended as medical advice, diagnosis, or treatment, and should not be relied upon as such. Listening to this podcast does not establish a physician-patient relationship between you and the host or any contributors. If you have specific medical concerns or questions, we encourage you consult directly with a licensed healthcare provider or physician in your area. The views expressed in this podcast are solely those of the individuals and do not necessarily represent the views of any affiliated institutions or organizations. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast.
Hey everyone, welcome to the second episode of our podcast. Today I'm joined by Alyssa Di Benedetto, who visitors to our office know very, very well. She's my first ever hire at the Dermatology and Laser Group, been with me since day one. She's the Director of Operations here at the Dermatology and Laser Group and our Cosmetic Coordinator. A lot of our patients and people who email and call the practice know Alyssa very well. And Alyssa was saying that one of the things that she thought we should talk about and she wanted to cover in today's episode was something that's been in the sort of social media world and even in magazines and things like that quite a bit over the last couple of years, and that's RF microneedling, kind of made most popular by, as you were saying, Morpheus 8, which kind of got a lot of buzz going with posts with like Kim Kardashian and other Instagram and TikTok celebrities, and
yes, I feel like it did come out very strong. Everyone wanted to do it, everyone was doing it, and then I have noticed recently, which is kind of showing on Instagram, that people are feeling a little bit more negative. They're seeing bad effects from it, which I know you've always had a very strong feeling about that from the beginning, so I think we should definitely review that.
Sounds good.
So should people be getting RF microneedling on their face?
It wouldn't be at the top of my Christmas list, so I think there's, for multiple reasons, there's better devices for facial and neck rejuvenation than RF microneedling, no matter what brand RF microneedling you're talking about. And we do have a couple, and we'll kind of go over the fact that we do have a couple of RF microneedling devices in the office. So before we get started, let me just get that out of the way. Any conflicts of interest? I am a paid consultant for a few companies that produce RF microneedling devices. But despite that, like I've said from the beginning, the goal with this podcast is the truth on everything and kind of being upfront and honest and very simple with our discussion. So yeah, I'm not a huge fan of RF microneedling for the face and neck. We can do it, and we do it every now and then, and we'll get into why. But the social media trend began, and everybody was very excited about what they were reading on TikTok and Instagram, and also magazines and websites about the skin tightening effects and lifting effects of these devices. We had patients coming in even before it was a trend asking about it, because we have pretty knowledgeable patients. And, I've always kind of said, stay away from it. Wouldn't recommend it. I was seeing bad things in people who were getting it. I had sort of extra access to the clinical studies from the manufacturers of some of these devices and saw long-term results, and I was concerned that the patients looked better 3 months after the procedure when their skin was tighter, but they actually looked like they'd aged a bit when you looked at pictures a year down the road or even 6 months down the road. I start to get a little concerned. So, yeah, I was kind of fighting the trend a couple of years ago when everybody was talking about it. And it all kind of started when I think Kim Kardashian was linked on Instagram getting a Morpheus 8 procedure. It wasn't clear where, but it was sort of assumed that it was the face. That wasn't clear. And then, the social media influencers then started posting it as a life-changing procedure, and I look 10 years younger and blah, blah, blah. I was like, uh-oh, this is going to be bad. Mm-hmm. I'm glad we didn't succumb to it. I'm glad we didn't do it, those sort of treatments for our patients. And like I said, we have done RF microneedling. We will continue to do RF microneedling when appropriate and for the appropriate things, and we can get into that. But now, as you mentioned, what you keep seeing on social media is people talking about how it ruined my face and it melted my fat and my skin texture's ruined and I have more wrinkles and all this stuff, which is kind of what I was expecting to see. Yeah. And it's finally caught on.
Yeah. So like you mentioned, we do have 2 of these devices, and I know that you do not have devices in the offices that you don't truly believe in. So if we can talk about kind of what we use those for.
Yeah, so body treatments, as you know. So I think wouldn't you say that's kind of mostly what we use it for? Yeah. A lot of people after pregnancy, people with like laxity in their arms or above the knees, but abdomen is probably our number 1 place after pregnancy. Yeah. So I'm fine with it on the body. So the main problem I have with RF microneedling is if it's used incorrectly, which I think it is honestly the majority of the time, unfortunately. And by that I mean if it's used at too high of a setting, you're introducing too much of too high of a temperature at the tip of these RF microneedles. And potentially you are damaging the fat right at the tip there. So with radiofrequency is a great technology if it's used correctly. If you use the appropriate temperature, which is in the low 40 degrees, like 40 degrees, 41, 42, on the skin, you can get collagen and elastin generation. You could get smoothing of wrinkles. The skin gets a glow. It actually gets hydrated. They can cause an increase in hyaluronic acid production, so the skin looks hydrated, looks and feels firmer. I love traditional radiofrequency. When you're doing it with microneedling, the way it works is the tip is very, very hot, and then as you get away from the tip, it's a little less hot. If you get above 45 degrees Celsius, you can actually permanently damage fat cells. And that's not something you see right away. So the fat cell first dies, and then it sort of slowly empties and dies off over the course of a few months. And it's absorbed. So, that worries me with the way most people are using RF microneedling. We will use it on the body, if on somebody's abdomen, because if we lose a little bit of fat, if we're using it at the strong settings, that's still okay. And we'll use it anywhere, as long as the temperature is really turned down. The one thing that patients then need to be aware of is then don't expect a skin tightening, a profound skin tightening, or certainly not a lifting effect or anything like that. So, that's why I say it's not my favorite device for face and neck rejuvenation, because we have better things. We can use it if it's a convenient thing to use. Or very rare cases, like if you want to eliminate a little bit of fat under someone's under their lower eyelid, we can actually use this side effect to our benefit. But we use it judiciously in the right places, right time, for the right person.
Yeah. And then just to kind of get into some cool things that we have on the device that we currently use, one like the Potenza that has the infusion tip. If you wanted to.
Yeah, so that's one that we, so there's 2 that we have in the office out of all the, dozens and dozens of RF microneedling devices out there. The Potenza, like you mentioned, has the infusion tip. So that's a cool technology where it it has like a spring that it kind of pushes in the serum that you have on the face, whether it's PRP or growth factor serums or things like that. We can push it in with force with that, which I find really cool. So we turn the energy way down. We are basically using it like a microneedling device. And we're getting a little bit of benefit from very gentle heating as well. And then another one is Exion, which is made by BTL, which is, again, sort of really gentle, not super painful the way the RF microneedling devices can be. Quick and easy, minimal downtime. And that company is very sort of concerned with getting it right with, I know their science people pretty well, with making sure that their technology is producing collagen and elastin, not getting too hot, being gentle. They've shown the hyaluronic acid increase in the skin. So there's a couple of products, and that's why we picked those, because they were safer. But yeah, I still wouldn't use those if like somebody said they wanted a lift in their face. I may then use something like All Therapy, which I can use safely because I could see exactly where the heat's going. I could use M-Face, which does it in a completely different way by building muscle tone. So they're not the device I would use for lifting and tightening, but they do have their place for certain people.
Yeah. And then just to go back to treatments for the face, what are the other side effects or issues other than the fat loss that
not much. So if you do it correctly, both the fat loss and other issues are not there. So what we have seen sometimes is if, again, high energy is used and the needle depth isn't appropriate, you could get weird texture in the skin too. So instead of forming collagen and elastin the way our body normally has in the skin, you form these collagen tracts that are essentially scar tissue. So the skin gets like a textured feel, and I feel like you almost see the pores more clearly. Not quite a orange peel peau d'orange as they call it. Fancy. Not that kind of skin texture, not that severe, but the pores seem a little bit more prominent. The skin looks a little woody, a little bit more texture that you're seeing.
Yeah.
That used to be a bigger problem like 5 years ago when the first devices had come out. The needles weren't insulated correctly, so a lot of heat was going to the surface of the skin. With the more modern devices, that isn't as big of an issue. It still is, though, a lot of sort of user dependent. So you don't want to have super high settings, and you want the needle to be at the correct depth.
Yeah. So why do you think people are still using this device incorrectly, and people are still going to get it?
Well, the social media trends, they take a while to die out. And then, more important than that is the fact that when these trends started, we had a lot of pressure on us as providers to provide this for our patients, supply and demand. Patients were demanding it, and we need to supply it. And a lot of doctors, med spas, and other sorts of clinics ended up buying these. And some, it's their only rejuvenation device for some clinics, and they've spent $100,000 or something like that on these devices. And that's a big investment, and you need to use it to make your money back. And you unfortunately have a lot of people just using it for crazy things, like inappropriate things that it makes zero sense for, like acne scars or things like that, where there's so many better devices like microneedling alone or lasers. Mm-hmm. And it's kind of that when all you have is a hammer, everything looks like a nail sort of expression. So people have bought these devices, they want to use them. Oftentimes, in a lot of med spas, it may be the only rejuvenation device that they have.
Do you think there's one better than the other in terms of devices for RF microneedling?
No, I think it really comes down to the person using it. So all of them can be used correctly and safely as long as the person who's doing it knows what they're doing. And is conscious of it and isn't pushed to produce results that are unsafe. Isn't pushed to try and over tighten or lift or do anything crazy like that.
Yeah. And we've mentioned that we have tons of other equipment here that we use. So what is kind of the alternative to doing RF microneedling?
Yeah, so that's one thing I think it's important to any practice you're going to get facial rejuvenation or neck or body or anything like that. You want to make sure they have options. They're not using a one size fits all, and they can kind of tailor make their approach to what your individual needs are. So it really depends on what you're looking for. Like I said, if you're trying to get a little bit more of a lift, something I call therapy, M-Face would be my go-to. L-Therapy actually being even FDA cleared as a non-surgical lift. If you're doing just general face rejuvenation, lasers are great. RF alone, strangely enough, is great, and microneedling alone, strangely enough, is great. So if you take those two components and separate them, and we do this for some patients who really have, their friends got RF microneedling and they really want it, we say we can do it really light with our RF microneedling device, or even better, we can separate out the two. And the reason it's better, so RF devices like Temperature, Thermi, things like that, they're wands that are like massaged on the skin, and they are very precise. Within milliseconds, they can measure the temperature. So whatever energy they're putting in, they can measure exactly what temperature your skin's at, so it can never get overheated. And you maintain the temperature and get collagen and elastin generation throughout the whole skin. So it's not just in certain areas where the needle's going in or this or that. It's massaging the entire surface of the skin. You get great, deep collagen and elastin with these in the dermis.
Pleasant procedure too.
Yeah, not super painful, no downtime. If you want more textural issues, things on the surface, and you don't want to do a laser, the microneedling alone is great. And why microneedling is better than RF microneedling? A traditional RF microneedling device uses a stamping technique. So you're getting just where the device stamps, you had that series of needles, go in, then you go to the next spot, and the same thing happens. With a microneedling device, you're getting thousands of little pokes, so much more collagen and elastin generation, much more damage being created, healthy damage being created by these needles on the surface of the skin, again, covering more surface area and having a safer treatment because that heat's not being used. So weirdly, the RF microneedling, separating out the two components is a great option. Lasers are great. There's ultrasound devices. There's muscle building devices. There's injectables. There's lots of things. It really depends on the need.
Mm-hmm. So if somebody's very set on getting RF microneedling, that's what they have in their mind, what do you suggest that they do to get the best treatment?
I think go to a provider that is very experienced. That's one thing. A well-educated, look at their education background, look at their experience. Go to a place that has lots of options to offer you. They're not just like, you come in there and no matter what you say, they say, this RF microneedling device will cure all your needs. You know, that's a red flag. And then don't push them for amazing before and after results. A good RF microneedling, you should barely see anything or nothing at all on your before and afters. So you want your skin to look a little smoother, a little more hydrated, a little bit more glowy, and not tighter, not lifted. None of that stuff. If that's happened, you've potentially permanently damaged your skin.
Yeah.
And long term, you've aged yourself. So bad decision. So you want to go super light.
Yeah. I feel like that's one thing that I've learned working for you for all these years, that, you know, just going slow into a treatment, doing lighter treatments, in the long run, you're going to get the better results, you know, and sometimes you may need something stronger, but for most just cosmetic concerns or aging, we'll do the lighter options.
Yeah, I mean, I think that's probably best with almost everything, even like surgical procedures that plastic surgeons do. You know, taking a less is more approach is definitely our way, but I think it's the right way.
Yeah. All right, so switching gears now, for this week's review of TikTok and Instagram trends, I wanted to talk about collagen supplements, something that patients will ask a lot. if they should take them to maintain their results. And I find it's mixed reviews everywhere on how people feel about them. So what are your thoughts?
Yeah, I have no problem with them. I think they're a good source of protein. So collagen's a protein. It's found in our skin, cartilage, connective tissue, veins, hair, nails. It's found in animals. It's a big component of our body. It's basically a series of 3 long peptides made of amino acids, glycine, proline, hydroxyproline, different amino acid combos, and different types of collagen. Oh, there's lots of types of collagen, by the way. And the collagen in our skin gives it its structure. And we talk about it all day long with all of our procedures. We're trying to maintain and generate new collagen. The collagen that you consume in these supplements is a healthy way to get protein. The one thing, I think it's a little bit of marketing, but they make you think that you're consuming the collagen and somehow it's going into your bloodstream and popping into your skin as collagen, or popping into your nails as collagen, or hair. That's definitely not happening. It's just breaking down like any other protein you eat, the protein in your steak, the protein in your almond, or whatever food you're eating. So it's breaking down into amino acids and small little peptides getting absorbed in your blood, and your body decides what to do with it. Maybe it's going to repair muscle, maybe it's going to use it to burn as calories, as energy, maybe it's going to make collagen. So there's nothing magical necessarily about collagen. You're primarily talking about 2 types of collagen. There's marine collagen, they call it, which is fish, fish skin. And they call it, it's again a marketing term, but they call it grass-fed collagen. They never say, so that's cow. So those are the 2 types of collagen you're consuming. That fish skin isn't like going into your blood and becoming collagen for you. You're not getting rid of wrinkles that way. There are some studies that have actually shown that consuming collagen peptides and collagen supplements could potentially improve skin texture, skin hydration, things like that. But there's nothing particularly special about those studies, because the same thing has been shown with consuming whey protein. So that protein shake that you eat that's dairy derived has the same studies behind it. And same thing has been shown with soy protein. So edamame and soy protein shakes and all tofu have also been shown to have the same sort of skin benefits. So there's similar studies for all of them. I'm not convinced that there's anything special about collagen, but it is another good healthy source of protein. And I know a lot of people like it. Like, I know you like it.
Yeah, I mean, I've been highly influenced to try it. One specifically that Jennifer Aniston really likes, and I'll do anything that she likes. And what's nice about it is it just dissolves in anything you want to put it in. So
that's what I found about it, actually. With collagen, as opposed to like when you have like a whey protein shake, it's so filling. You know, it's like a meal. The collagen, you don't even you could literally have it in like the collagen water, and it's just hydrating like water. So it's not a big deal. I actually have read I've never tried this, but on Instagram, that you can actually bake with collagen. It's really heat resistant. I don't know how well that works, but I've heard of people like baking it into cookies and stuff like that too, just to add a little protein. Yeah,
I've seen people putting it oatmeal and I
think it dissolves easily, and it's heat resistant, so why not? No, I have no problems with collagen. I don't think it's magical, but so I don't think it's necessarily any better or worse than having other sources of protein. That hasn't been proven, but it's a healthy source of protein, and protein's good.
Yeah, anything to make you feel good about it.
Yep.
And then every week we're going to talk about a skincare product. So one of my favorites, and an office favorite that I really love, is EltaMD UV Clear. I use that every day for years. It's super light, easy to put on. I can wear makeup over it. They have a tinted shade, which is nice for summer. And then they also came out with a deep shade as well. So yeah.
Yeah, I love that you picked that one. That's kind of when we have a new patient come into the office and we ask them about their skincare, that's like 90% of the time the one they mentioned. And since the beginning of my career, I feel like we've been mentioning it as a recommendation with the niacinamide that it has as an ingredient. It's helpful for acne-prone skin, rosacea-prone skin, anti-inflammatory effects. It's broad spectrum, protects well against skin cancer and aging. It's lightweight. People like it. Like you said, the 3 different tinted and 2 different tints and 1 untinted, so 3 different varieties of it. It's a super popular product. I think a great pick. That's like out of that sort of class of sort of physician-recommended skincare products, I think that's number 1. It's got to be the number 1 recommended dermatologist product. I don't know if that's true or not, but it feels like it's got to be because all my friends who are dermatologists use it and recommend it as well. It's like in everybody's house.
Yeah, I've never heard anybody have any issues with it.
No.
I have super sensitive skin and cannot use anything, and that's always been an easy product for me.
Yep. Yeah, no, good pick.
Okay. All right, well, that does it for this week, and we hope you all enjoyed. Make sure to follow and review our podcast. Reach out with any suggestions. We loved hearing from all of you last week. And
yeah, we've been getting a lot of people DMing and filling out our contact form. It's been really cool. I like the feedback. Thanks.
Yes, of course.
All right. Thank you.
Thank you so much for tuning in today. If you enjoyed this episode, please make sure to subscribe to Dr. A Explains It All on your favorite podcast platform. By subscribing, you'll never miss an episode, and you'll be the first to hear about our latest discussions on skincare, cosmetic procedures, and more. And if you found this content helpful, we'd love for you to leave a rating or review. It really helps us reach more listeners like you. To learn more about our podcast or to send us questions you would like answered on here, please visit our website at drapodcast.com. That's drapodcast.com. To see us as a patient at our New York clinic, visit us at dermatologyandlasergroup.com.